Hi, I'm Jen. I'm a registered nurse here at 8 West, and I've been doing cosmetics for 16 years. I'm hopefully here to answer any questions about Dysport for you today. It's really interesting because while I was in nursing school, I remember my grandfather, who was probably in his 70s at the time, going to a doctor to get treated for a spasm he had around one of his eyes. And I remember him coming home, and it was at dinner time, and he was saying to me, "Jen, does it look like the wrinkles on this side of my eye are so much better than the other?" And there was a very obvious difference between the two eyes. And lo and behold, years later, I find out that the Crothers had been studying the cosmetic use for Botox after they had realized that people were very curious about treating their other eye with Botox without the spasm so they could look young on both their sides. Botox is actually so popular because it's the household name, just like Kleenex and Q-tips are. And the reason being was that Botox was the first FDA-approved cosmetic treatment for wrinkles in Canada. What people don't understand is that Dysport was the first available neuromodulator in Euro-Asia, much before Botox was. It was 10 years later, after the non-compete clause was removed, that Dysport was able to come to market. Starting your neuromodulators younger allows for the old adage that prevention is easier than correction. When you're young, your skin is very elastic. Most of the time, you don't have static lines in your face. You can use a smaller amount of Botox to prevent lines and wrinkles from occurring in the future. When you're older, sometimes you're not going to get an immediate response like you would when you were younger. Occasionally I have a more mature woman or man coming to me that already have static lines. Their expectation is that after their first treatment with Botox, those lines are going to be gone. Unfortunately, when you already have static lines that are deep, it may take a year or more to have those lines completely disappear, or may never completely disappear without other treatments like lasers and fillers. So when you start younger, you may be able to prevent those static lines from ever occurring as you age. Men typically do not require a different type of treatment. Sometimes they require a significant more amount of units though, because their muscles can tend to be a little bit more stronger in their face, and to get the relaxed, pleasant look that they're looking for, sometimes they're just more expensive. But that's not always the case. Sometimes women are just as strong as men and require just the same amount of units. It really is a unique, individualized treatment. For an effective treatment, some people come back and ask me, "My Botox only lasted 2 months. How come?" Well, if I look at the dose and the person has been treated with a decent amount of Botox to the point when they came back for their follow-up, they weren't moving the muscle that they were targeting, I would suspect that the treatment should last 3 to 4 months. But oftentimes when Botox is only lasting 1.5 months to 2 months, sometimes I feel that it's a dosing issue. Today, people aren't looking for that heavy look with no movement that's not natural. People are really hoping for a movement that is fluid with our harmonious connection to their face. Really, our goal for our patients is for them to get a very adequate treatment for about 3 to 4 months. If they're getting less than that, we would really consider increasing their dosage. We don't want people to have to come back too often. It's inconvenient. People's time is precious. And if they get longer than 4 months, we're really hitting it out of the park. Oftentimes people are so concerned about lines and wrinkles when they come to see me, they don't make people look unattractive. As people mature, you can be very beautiful with lines and wrinkles. It shows character, and that's not a problem at all. The first area that I love to show people is that they can take the negative expression of anger out of their face, they can reduce their tired look, they can reduce the resting bitch face, the lower frown, and stop a lot of distracting movements and expression if they're overly expressive, and just give them a very relaxed, approachable look. Hey everyone, thanks for joining in today. Hope to see you in the clinic soon.